You're listening to Health Professional Radio. My name is Wayne Buckler, and my guest today is Clare Cotter, Director of Call on Clare, a business based in Melbourne, Victoria. Clare, welcome to Health Professional Radio.
Thank you, Wayne.
Now, Clare, Call on Clare is a name that doesn't give a lot away. Just explain to us what it is that Call on Clare does.
We do a variety of different things. We take people to medical appointments. We pick them up. We transport them to the appointment. We take notes. We act like their advocate when we're in the appointment with them. Those notes are then sent to other health professionals that are involved with the care of that person, sent to the family, and also the client has them to refer to. Quite often, when you're ill, you don't take things in, so it's good to have someone assist you. Plus, if you've had surgery and you might not be able to drive, we drive you to that appointment. We provide care in the home post-surgery. Quite often people are discharged too early and they need help at home. So we have nurses that can assist people until they're independent. We take people out for socialisation. We take people to weddings and look after them. They might be elderly, frail or chronically ill. And that means that the family can get themselves ready. They don't have to worry about the member of the family that's ill. We look after them all through the ceremony and take them home when they want to go home, and it doesn't disrupt the event. We also have got a specialist palliative care team where we look after people in the home that wish to die in their home. We set up a hospital bed. We've got everything that you might need that a hospital would have, catheters, needles, syringes, everything there is supplied in the home. And we have training for those nurses. It's a specialised team. We're the only one that have specialist trained palliative care nurses that we provide training for once a month, and that goes towards the girls' registration, so it's recognised by the Nursing Federation of Australia. We do just about anything that a client requires. All of our staff are Div 1 or retired Div 1, and they're all interviewed in their private homes, and we meet their references personally. And I'm just touching wood here, we've never had anything untoward happen to any of our clients.
Clare, that's certainly a much wider service than just a nursing service. How did you get into this sort of arrangement?
I was ill myself. We've been going now for about 6 years, and I was ill post-surgery myself probably about 7.5 years ago, a bit longer. And I wanted somebody to take me to my appointment. Not only was I not able to drive, but I needed someone to look after me because I was a bit unsteady on my feet. So I wanted someone to come into the appointment with me. And even though I've got a nursing background, my thinking wasn't that clear because I was unwell. So I wanted someone to come with me and take notes so that then I could refer back to them. But unfortunately, I didn't have anybody that was available because a lot of people, they're all working. And so it was another month until I could actually attend the appointments that I needed to attend when I was able to drive myself and well enough to get there. So I could see that there was a need out there in the community.
So really you've invented a business designed on your own needs, and obviously it's resonated in the community if you've been around for as long as you have. Would you do things differently if you're starting over again?
No, I don't think so. No, not at all. I've learned as I've gone along. I really started off with the idea in mind for medical appointments, and then I've had a lot of people approach me for social bookings. We've found the families have approached us and said that, their mother or father are isolated and they need to get out. Also, a lot of aged care facilities have approached us and said, can we take some of their clients out for socialisation? Because a lot of them are depressed. So we do that now. We take people out, for lunch or for coffee or to exhibitions. Also, that's how the palliative care came about, I had doctors approach us to provide palliative care for their clients because they liked our staff. So they wanted to use our staff. So I paid for training for the staff initially, and then as it grew, we've got a girl that's got her master's in palliative care that does the training. So we provide the training now for the staff. So it's all grown out of a need, rather than, it was my idea first for going to medical appointments, but the community, our clients have actually approached us with various needs, and we've provided the service for that. Also with weddings, we get a lot of people ask us for weddings, and we go in and prepare the clients, get them dressed, put their makeup on, and look after them.
Now, sometimes, Claire, you don't get a lot of notice. Can you respond very quickly?
Yes. Most of our bookings, over 60% of our bookings are on the day, or we get bookings the day before, because the family might be sick that are going to take their loved one to an appointment, or the client themselves are sick. So they'll ring us up and say, can you take us to the doctor? I think there's only been about 4 or 5 bookings we have not been able to fill.
That's a great service to offer. Claire, if you're talking to doctors and nurses in hospitals, which is the majority of our audience, what would you like them to know about your service?
That we've got skilled nurses, that they're professionals. They're all DIV 1 nurses or retired DIV 1 nurses, not meaning elderly, but they may have given up their practicing certificate when they had children. So they can care for the client. So they know how to transfer the clients in and out of wheelchairs if they're in a wheelchair. They know if the client, needs medications. They've got that medical expertise, because even though we charge carer rates for a lot of our bookings, our clients get professionals to look after them. Also, they can communicate with the doctors and the nurses. They know what they're talking about, and they can then translate into everyday communication to the clients themselves.
Claire, do people need to be referred to you, or can they just self-refer?
They can self-refer. Absolutely. They can give us a call and we can go through what we do. We can come out and meet them. There's no cost for that. We can get a medical history. A lot of our clients are referred by hospitals and doctors themselves. But yes, absolutely, they can give us a call.
Now, I'm always getting into trouble when I do this, when I say give us a call and then I don't give a number, Claire. So what's the best number to call you on?
It's 039001 9762.
And if you missed that number, it'll be available on our website in the transcript. Claire, if there's a misconception about your business and about what Call on Claire does that drives you nuts and keeps you awake, what's that misconception?
That we're just a carer service. People think that we provide in-home care, which a lot of services do. We do in-home care, but it's very specialised. We provide trained staff for that. Our staff, there's the trust issue with our staff, that they're all interviewed in their private homes, and I meet their referees personally, that they speak clear English. It's a highly professional service. So it's not just a carer that comes to attend to the professional staff member, and they can take them to their doctor's appointments, act as an advocate for them when they go to the doctors. Yes, much more than just a carer.
You've been listening to Health Professional Radio with Wayne Buckler. I've been in conversation with Clare Cotter of Call on Clare, a Melbourne-based service. Now, for more information, the website's www.callonclaire.com.au. We'll have a transcript and an audio file in our archive at www.hpr.fm. Claire, thank you for your time. It's been lovely to chat with you. It's a service that I'm sure lots of people will need either now or in the future.
Thank you, Wayne, very much for giving us this opportunity.
A pleasure to talk with you, Claire. This is Wayne Buckler for Health Professional Radio.